of Polycystic Ovary Syndrome, or PCOS? It sounds a bit complicated, but it's actually way more common than you think. In fact, 1 in 10 women are affected by it. PCOS can show up in many different ways, such as irregular periods, sudden weight changes, acne, excessive hair growth, and even difficulty getting pregnant. But because these symptoms are so general and often overlap with other issues, PCOS often goes unnoticed or takes years to diagnose. Dr. M. Devindran, an obstetrician and gynecologist from the Guan Specialist Center, explains why this delay happens, especially for women in Malaysia.
Many of these patients may be asymptomatic. For example, if they have excessive hair growth on their body, many of them do not really think about going to see a doctor. They may think that, oh, this is normal. You may also see particularly South Asian women who are generally more prone to develop PCOS, having more body hair. And among them, it may appear to be normal. Much later, if they get married and they have difficulty conceiving, it is only then that they will go and see doctors. Usually, by and large, you find that many of these problems present themselves during adolescence. And because they don't really have any major issues, there is a delay in seeking medical advice.
But it's not just the medical side that makes PCOS hard to diagnose. In Malaysia, cultural norms play a big role. Dr. Devindran points out that many women hesitate to speak up on their symptoms because they see it as exposing some kind of weakness. And this silence makes getting help even harder.
Definitely our cultural background, right? We are very shy to expose any of our weaknesses. We don't want to talk about any of our medical issues in an open community. We don't want to expose what we presume to be a form of weakness. If I have fertility issues or if I have PCOS issues, I am not very keen to come forward and tell the whole world that I am sufferer of this condition. There is a very deep-rooted cultural issue in our society that is not willing to talk openly.
And that hesitation often means women put off seeing a doctor, even when they feel like something's not right. But Dr. Devindran reminds women that they are not alone and PCOS is treatable.
So first thing is that you are not alone. Okay? And number 2, it's not like you have to blame yourself and that you are doomed, because there's a lot of help. It's very important to know that if we identify the condition early, it's very treatable. We can't cure it because it's a metabolic syndrome, and the basis is genetic. But lifestyle changes is very important. And number 4, you must remember that this is a lifelong condition. But don't despair, because people have lived very long with proper intervention. They can have a very complete life.
PCOS might be common, but that doesn't mean you have to struggle in silence. Like Dr. Devindran shared, you're not alone, and with the right medical care, PCOS can be managed. The first step is simply reaching out for help.